So today's webinar that we're going to be having today is going to be about managing arthritis, or about overcoming arthritis. And I just wanted to thank you for watching. Obviously, we're looking at trying to help people get better health and be as holistic as possible, do things naturally as possible in order to try to help people get fixed. When it comes to what I do, I have a variety of certifications. I have a specialty in sports. So we do sports medicine. There is multiple different things about exercise, and I do different stuff with Graston technique and kinesiotaping. So there's a handful of different things that I do. I've been dealing with arthritis and helping people that have arthritis issues for years and years and years. So this is one of those kind of things that is, you know, exactly in my wheelhouse of things that I deal with on a regular basis. Now, when it comes to arthritis, people throw the word around a lot and not everybody knows exactly what it is. Arthritis itself is typically that people think about one specific type of disease that people get, which is osteoarthritis, when people get and talk about the word arthritis. But arthritis is a whole host of different diseases, but it has to do basically with different things that affect the joints. So things that cause joint pain, joint diseases, stuff like that. Everyone has the ability to get affected by this, all different ages, all genders, races. It's one of the biggest forms of disability that we have in the United States. And up to 50 million adults and 300,000 children have some type of arthritis. And again, there's over 100 different types of arthritis. And the most common ones are things like osteoarthritis, rheumatoid arthritis, psoriatic arthritis, fibromyalgia is kind of an arthritis, gout, and lupus. So again, the two most common there are going to be osteoarthritis, which is going to be the #1 cause of disability, and then rheumatoid is another one. Now, to talk about this, you're going to have to look a little bit at the joint and see what happens. This is a view of a shoulder joint here. So I'm going to see if I can get this little laser pointer here so you can actually see what I'm looking at. But this is what a shoulder joint looks like. This is a cross section of a shoulder joint. And this is a picture of what a joint looks like. This is talking about synovial joints, and synovial joints are a specific type of joint in the body. We have multiple different types. Some of them don't have joint spaces. There's different spots in the spine and between the intervertebral discs and the pubic symphysis, stuff like that, the sutures that are going to be in the head, that they don't have spaces. But the stuff that we're talking about today is going to be talking about mostly about synovial joints, which are going to be the most common kind of joint that you end up having in the body. Now, the way that the synovial joint works is that you end up having this cartilage that's going to be sitting on both sides. It's a specific type of hyaline cartilage that will sit on both sides of a joint. So it's in blue over on this one, and you can see it wrap around over and through here as well. Again, you've got the cartilage on both sides of the joints, and then the joint space is going to be filled with a fluid. The fluid is called synovial fluid, and the synovial fluid basically makes things, it helps things to be a little bit slippery. The hyaline cartilage is slippery by itself, so when you have the wet fluid and then you end up having the slippery hyaline cartilage, this is going to be moving across itself, and it's going to be able to move back and forth without having too much slippage or friction or different kind of stuff like that. So it allows things to move and allows things to do it, especially when you end up having a compression or a little bit of load that's on that joint. Now, this is what it looks like inside the joint of the shoulder here. You can see that right in through here is going to be where some of the cartilage is starting, and the cartilage is going to be moving its way all the way up and around, up and through here. Because again, the shoulder is going to be able to move all around, so you're going to end up having a large range of motion there. So you're going to need to end up having a lot of cartilage all through that joint. On the other side of the joint, this is going to be where where you're going to end up having more stuff. The labrum and other kind of stuff is going to be sitting on this other side. And again, when you have this, this is going to be all cartilage up and through here, cartilage all through here, and back and through there. All of that stuff is cartilage. The other stuff that you end up having is that you end up having this Inside of the joint cavity, again, you end up having the synovial membrane that wraps around here. That's what makes the synovial fluid. And then you have this fibrous capsule, which is super important for the kind of things that we're going to talk about later on, especially. But this capsule that you end up having in all of these synovial joints can end up getting bound up and can end up getting restricted. So this is when you end up having damage that's going on the inside of the joint and a lack of movement on the inside of the joint. You end up having restrictions that can build up on the outside of the joint that can end up causing problems. So there's a whole host of things. There's, again, you can see other stuff that's on that slide that's there. But again, there's multiple different things that are going on inside the joint here. So the thing that's interesting about cartilage, though, is that the way that cartilage works is that it doesn't have a blood supply like the way that the rest of the body does. So if you talk about like in someone's hand, you have veins that are running in your hand, and you can just kind of squish one of those veins, and that's not a big deal. Same kind of thing with an artery. You can push down and you can squeeze on an artery in different ways so that you can actually feel the artery, and you could actually like cut off the blood flow if you wanted to. But because you talk about something like, let's say, your hips or your knees, those are going to be taking the weight of the majority of the body. So you wouldn't want blood vessels that are running through there. Number one, when something was going to move back and forth, you wouldn't want the blood vessel grinding, and that could make it break or cause problems. But at the same time, it's going to squish, and if it's going to squish all day long, then that's going to cut off blood flow. So if you're standing for 3 hours or 8 hours or whatever, you're going to end up having problems when it comes to each of those things. So the way that the cartilage works in joints is that it works kind of like a sponge does. If you can think about how a sponge is going to end up, if you're going to try to take a soapy sponge and try to get the soap out of the sponge, you're going to have to take that sponge and run it under clean water. You want to squeeze the sponge, and then you're going to let the clean water come back into it, and you're going to keep squeezing that until you get all the soap out. And that's the way that the cartilage works in the body, from the standpoint of you have to stroke the cartilage and move the cartilage in order to make sure that the cartilage stays healthy. By squeezing the cartilage, you're squeezing out all of the waste products. Lactic acid and other kinds of things are going to get squeezed out of that cartilage because it's filled with living cells. And those living cells are the things that help to maintain the cartilage and make sure that it is smooth and it actually moves, and that there's not any problems there. But the other thing that happens is that when you squeeze it, again, you're letting that good nutrients come back into the cartilage. So by squeezing it, when you allow the good nutrients to come in, again, you're talking about glucose, you're talking about oxygen, the things that the cells need in order to stay alive, you're going to sit there through that, and that's going to be the way that everything is going to work there. So again, you have multiple different things that are going on with the cartilage and through here, and that's how cartilage in general stays healthy. Good movement of the joint is going to help to keep the cartilage healthy, and then good movement of the joint is also going to help to make sure that the capsule that's on the outside, and again, you can see that the capsule is shown here on this, but at the same time, you also end up having the capsule is shown down here at the bottom, and you're also going to have a little bit of a capsule here. And again, that's surrounding the joint on all sides of the joint that's there, where there's not like bone or something like that in the way. So there's multiple different things that are going on and through that. And that's the general idea when it comes to the way that joints generally work. So to go back to osteoarthritis and some of the different issues that you might have, osteoarthritis is going to be where you end up having problems with that. Osteoarthritis is the most common of the different types of arthritis. When people talk about arthritis, usually they're talking about osteoarthritis. Again, because osteo and rheumatoid are the two most common, typically osteoarthritis is going to be the one that is going to be referred to the most. And osteoarthritis is typically a type of degenerative type of arthritis. Again, you end up having multiple different things that are there, but you can end up getting damage and degeneration in the joint, and it can happen from a couple of different ways. Basically, either the joint moves too much, there's too much motion over time, and the too much motion wears down the cartilage, or you can end up getting a situation where the joint just doesn't move enough. And if it doesn't move enough, again, the general idea is that things are going to rust for the most part, right? So the lack of movement makes it so the cartilage isn't healthy and it doesn't get moved and stroked the way that it needs to. Whereas the other way is that if you end up having damage, or anybody that basically has had like an ACL repair, for the most part, is going to end up having, every time that they step, there's going to be a little bit too much movement of that knee joint every time that they step. And over time, over the years, you're going to end up getting, problems where you probably need a knee replacement or something like that. Again, if you can get things treated early, again, hopefully that's something that you can avoid. But again, the common symptoms that you would end up getting with osteoarthritis is going to be pain in the joint during movement. Again, that would be passive movement. So if somebody else is moving it, or if you're moving it yourself. Joint tenderness when you're poking the joint or when you're pushing on different areas of the joint. Stiffness if you end up having a time of inactivity. So if you sit for a period of time and then you go to stand up, and starting to move again, you need to start basically warming yourself up in order for you to be able to do the activities that you want to do. Getting a loss of range of motion, getting that grating type of sensation that you get, it's called crepitation. So when people sometimes, if you move your head back and forth, you can hear that noise because it ends up being down here in the neck, so people can have arthritis. And that's a sign of arthritis, is that crepitation. And it's not usually something to really worry about as long as it doesn't hurt, but it's one of those kind of things that's a typical sign of arthritis. And then you can also get bone spurs that actually occur around the joint. So little things would be, if we went back here to this video, again, if you're talking about off of the edges of the joint, you could end up getting bone spurs that would be coming off of the edge. And in some cases that can actually impede the range of motion itself of the joint. In bad situations, that cartilage can actually crack and it can break off and it can have other kinds of stuff in there. So there's multiple different issues that can happen with that cartilage, but again, it depends on what kind of damage is going on for the person. When it comes to risk factors, the risk factors that people get is obviously age is going to be one of the biggest risk factors when it comes to osteoarthritis. And then women are also going to be a little bit more likely than men in order to get osteoarthritis. If you have a little bit more weight, that's also going to be something that can have an effect. And sports injuries will have an effect. So again, anybody that's damaged the joint, if you continually sprain an ankle over and over and over again, that's going to possibly lead to a greater likelihood of you having arthritis in that ankle, maybe over time. And again, if you have a certain type of occupation that has repetitive types of stress in a joint, that's another thing that can end up having something that can have an effect. So the different types of pain, again, is the bone rubbing against bone. That's one of the things that people will talk about, is that the bone rubs against the bone, and that's kind of doesn't really happen. But you can get different bruising or different microfractures that occur within the bone underneath. People can develop cysts when you take a look at them on x-ray and different stuff. And there's just a bunch of different things that can end up coming with that. Again, the ligaments can start having pain because they start getting stressed too much. And again, that is going to be another thing that is extremely common with osteoarthritis. So then there's rheumatoid arthritis. Rheumatoid arthritis ends up being a different kind of situation, because with rheumatoid, that ends up being an autoimmune disorder. So basically, an autoimmune disorder is going to be when your immune system mistakes something that it finds as, it'll find something and it starts making antibodies against something that's outside of the body, but the antibodies mistake whatever it is that it's trying to get, and it actually starts to attack the synovium of the joint. So basically the antibodies start to attack the joint, and you end up getting a chronic inflammation kind of a thing. You end up getting flares and you end up having problems. So the immune system attacks the joints, and that ends up being problematic. And again, you can end up getting other areas that are affected in somebody that has rheumatoid. So again, you can have problems with the skin, the eyes, the lung, the heart, blood vessels, different stuff like that. And basically you can start eroding away bone. You can end up having joint deformities. When things have been developed a little bit more, to end up having a breakdown of some of the joints in through here. And then there ends up being this ulnar bend. So the ulnar bone is on this side, radius is on this side. You end up having a bending that kind of comes over for people that happens with rheumatoid arthritis. That's pretty common. And again, it usually starts in the smaller joints like the fingers and toes. It can end up getting issues with the wrists, the knees, the ankles, the elbows, the hips, and even up here in the top of the cervical spine, people can end up having issues with rheumatoid arthritis. But usually this is a different kind of a thing. Well, the other stuff is kind of like a slow burn and a slow problem. This is usually a fast kind of an onset where you end up getting like more of an acute inflammation type of response from it. So the joints end up being tender, they end up being warm. A lot of times they end up being swollen. You end up getting joint stiffness that's usually ends up being, again, in the mornings and after inactivity, which is about the same as the osteoarthritis. But people can also have problems with fatigue, fever, weight loss. There's all kinds of things that can end up having. And again, this is going to be something that is more common in women, and it can happen basically at any age between around 40 and 60. Again, people that have a family history, it's going to increase the risk. Smoking is going to increase the risk for almost any disease on the face of the planet. But smoking is going to increase the risk, and it's going to also increase the severity of the disease as well. And you can also have issues with, people that have problems with other environmental exposures or other issues can end up having problems with it. Again, being overweight isn't going to help this one either, because you're going to be putting weight on the joints. Psoriatic arthritis is going to be another type of autoimmune condition where you're going to end up having an inflammatory disease that's going to be affecting the joints. People that end up having psoriasis and problems with that are going to have issues. So there's going to be abnormal immune responses that are going to be going on. In order for people to have psoriatic arthritis, you have to have psoriasis. So that's going to be one of the things that's going to be there. So there's typically other kinds of factors. Just because somebody has psoriasis doesn't mean that they're going to develop psoriatic arthritis. There's multiple things that are at play, but anybody that has a history of psoriasis and start having joint pains and other kinds of stuff, again, there's a lot of times medications that can help in order to control that or maybe put it into remission. And again, the worse off that someone's psoriasis is, typically the worse off that the arthritis is or will become, especially if the person doesn't get it under control. So the psoriatic arthritis, again, people have swollen fingers, toes. Again, it can be hot, again, just like the rheumatoid arthritis. Foot pain, having issues with lower back pain can be part of that as well. And again, you have to have a family history. You have to have psoriasis. And typically the age of people that get this is going to be somewhere between the age of 30 and 50 years old or so. So those are some of the major arthritic kind of conditions that are there. Another one that ends up being something that we talk about is fibromyalgia. And fibromyalgia isn't exactly an arthritis, but it is a general widespread pain throughout the body. It basically affects the muscles because it ends up having problems with the brain processing how you deal with pain. So it's a central pain syndrome. So it's the pain that's kind of happening in the brain and the spinal cord. But because you experience all of your senses through your brain, if your brain is having a hard time shutting down the pain, then you're going to experience pain. It doesn't really matter whether or not it's something that's being caused like in the joint or in the muscle itself. It's something that your brain is going to experience as pain. Just like if anybody has had the experience of having tinnitus or tinnitus, which is that sound that you get where you can have a tone or a rushing or something like that in the ear. And if nobody else hears the sound, but you do, that doesn't mean that you don't hear the sound. You still hear the sound. It's just that it's not being created outside of your head. It's basically being created inside of your head, and it's something that you experience, just like an itch or something like that, right? So again, people that have fibromyalgia, again, there's issues when it comes to multiple different areas. So again, fibromyalgia is going to magnify pain sensations and have increase the amount of pain that somebody might experience. Again, people that have fibromyalgia might have more problems with tension headaches, TMJ, so temporal mandibular joint issues, irritable bowel syndrome, anxiety, depression. Those things are actually fairly common. Again, there's all kinds of different things that can go into fibromyalgia, and fibromyalgia can be an entirely easily separate lecture that we can talk about. But again, there can be triggering events that can be a physical trauma, it can be a surgery, it can be a significant psychological stress. And again, widespread pains that last for months at a time. Again, it usually goes on above and below the waist. Fatigue usually ends up being a major kind of symptom that's associated with it. So even if you go to sleep and you sleep for a long time, you have the tendency to still be tired, and you can end up having problems with cognitive difficulties and having problems with focus or paying attention or things along those lines. So again, fibromyalgia typically is going to affect women more than it's going to affect men. And when someone else in the family has had fibromyalgia, there's a greater likelihood that somebody else in that family can have it as well. And again, other problems like osteoarthritis, rheumatoid arthritis, lupus, things along those lines can all increase the risk of somebody having fibromyalgia. So the other thing that we can talk about here is gout. And gout is a specific form of arthritis itself, but it's not going to be something that's body-wide like the last couple were. Gout is usually going to be something that's going to be associated by the formation of crystals. And when you end up having the formation of crystals inside of the joint, every time that you move the joint, the crystals basically tear the joint up. So there's an accumulation of urate crystals, or you having too much uric acid. Either you have too much in the system or you have a hard time removing it out of the body fast enough. And this is typically something that used to be referred to something like a king's disease, which would basically be something that, you know, if you can't afford having rich meats and stuff like that, you know, back in medieval times and that kind of stuff, those would be the people that would get this. Again, now because we have the, you know, access to it, depending on what people are eating, that can be something that you can end up having regardless of socioeconomic status. So again, uric acid ends up being the formation of what happens when you end up getting the breakdown of certain kinds of proteins in the body. So steak, organ meat, seafood, different types of alcoholic beverages can all contribute to this. And usually one of the main ways that you treat this, again, there's medications that you can take, but it makes sense from a general standpoint to reduce the amount of foods that you're eating that can actually cause the formation of the uric acid crystals. So there's multiple different things that are there. You know, when these end up forming in the joints, again, they basically tear up the joints, and then they're going to cause pain, inflammation, and swelling. And again, so the people that have gout, again, intense joint pain, and usually for the most part, the first place that it hits ends up being the big toe. It's not all the time, but the big toe is going to be one of the main places that's going to end up getting affected by gout. Ankles can get problems with it, knees, elbows, wrists, fingers. There's multiple different places in the body. And again, the first 12 hours of getting affected or of getting things triggered is going to be the most severe, but pain can end up lasting for weeks at a time. You end up getting inflammation and redness. You end up having limited amounts of joint movements because, again, you're tearing up that joint every time that you're moving through it. So this does happen a little bit more often in men and women who are postmenopausal. And again, if you end up having a diet that's rich in meat, seafood, or you're doing a lot of beverages that have fruit sugar or fructose, that's going to be different things that are going to affect the amount of problems that you end up having. Obesity is going to be another factor with this. So again, people that are overweight are going to have more problems. And if you end up having problems with high blood pressure or other kinds of chronic problems like diabetes, metabolic syndrome or syndrome X, and heart and kidney diseases, those are all going to end up having factors at play, along with having a family history as well. So multiple different things will be affected with that. Lupus is another thing that's going to be affecting the system as well. Lupus is, again, going to be in a type of autoimmune disease. And lupus is one of those things that has the tendency to affect, it not only is going to be affecting the joint, but it's also going to be affecting the, let's see here, the skin, the kidney, the blood cells, the brain, the heart, the lungs. There's multiple different things that are going to be affected when it comes to lupus. So there can be different types of triggers, whether or not it's in the genes or environmental factors. You can end up having problems with sunlight or having an infection or a medication or different things like that. And lupus is one of those things that typically is going to be something that will be something that you would diagnose at a point by ruling out every other thing that's going to be associated with it. So you're typically not going to go to lupus as the first choice that a person might have when you're trying to figure out like diseases and other issues. So, but people can end up having other kinds of stuff. So again, if you go down the list and you rule out all of the other problems that a person might have, then lupus could be on there. But again, a lot of times when people have arthritis issues, a lot of times when you run blood panels on it, you can end up running specific types of blood testing in order to search for lupus, which would be the ANA type of testing. So there's multiple different things that goes along with that. But other symptoms that you can end up having with lupus, again, there's all kinds of different stuff. And anybody that ever watched House MD, it was basically the joke that they had that every single week, and it didn't matter what the problem was, you know, they always had lupus on the list of the possibilities of what was going on. So it's just kind of one of those things. So fatigue, fever, joint pain, stiffness, swelling, having a rash on the face that covers up the cheeks and the bridge of the nose, skin lesions that appear or worsen with sun exposure, being photosensitive, having Raynaud's, so having the issues where if you get a little bit cold, then your fingers or your hands will just go blue and they go painful, having shortness of breath, chest pain, dry eyes, having headaches, confusion, memory loss, things like that. And again, this is going to be something that is, again, more common in women, and it affects people typically ages 15 to 45. And it is a little bit more common in African Americans, Hispanics, and Asian Americans. So there's all kinds of different stuff. Now, the thing to remember that when it comes to most of this is that when it comes down to it, the symptoms don't really appear out of thin air. They're going to be something that builds up over time. And there's usually more stuff that's below the surface. So again, a symptom might be just at the tip of the iceberg, but there's a much bigger problem that's underneath the surface. Again, a symptom is just a symptom. It isn't going to be necessarily the cause. So it could start out as a little bit of joint pain, could start out as a little bit of stiffness, and things could be going on from there. So again, the symptom is going to be basically like the fire alarm going off to let you know that there's a problem. The fire alarm itself is not actually the problem. The fire alarm is actually going to be the thing that's going to help you try to take care of the problem. So you need to go put out the fire. You don't want to go and, you know, just turn off the fire alarm and shut it down. And that's one of the issues when it comes to medications, and sometimes the way that these kind of arthritic conditions end up getting treated is that the traditional medication like type of approaches that you end up having in the system is that you end up having an anti-inflammatory type of response. You're going to have anti-inflammatory drugs that people are going to try to throw at this. So again, if you notice that there were a lot of the different conditions that we ended up having on that list were autoimmune diseases. So if you give different things that are going to suppress the immune system, then guess what? People feel better. Okay. Again, some of these medications are going to have their place, but when you talk about especially osteoarthritis, and basically that's a different type of inflammation. It's not the acute, typically it's not the acute, like things are swollen up and you end up having problems from that. Usually it's like a slow burn or a slow issue that goes down over time that people can end up having. So you end up having different issues with each of those different things. And again, anti-inflammatory drugs, people don't realize how many issues that there are with that. So again, 100,000 hospitalizations at a cost of about $4 billion based on anti-inflammatory drugs. Again, there's multiple different things that happen. 10 to 20,000 deaths per year are caused by some of these medications. And again, it helps people a lot, and a lot of people end up having problems, but this does help a lot of people, but that's not necessarily like the go-to. That's not the fix. It's not the thing that's going to end up basically fixing the problem, right? There are different things that you can do in order to help to increase how well your quality of life is, but just taking medication isn't going to be a way to do it. Again, joint replacement surgery is another thing that's going to do some of that problem that's there. So again, you have multiple different issues that can happen with this. Again, there's going to be some situations where joint replacement surgery is definitely the way that a person needs to go. But when it comes down to it, again, we want to try to delay that as long as we possibly can. If you can delay it and delay it and delay it, then it's going to be better off for the person. So if you can find other ways to help to control the symptoms, then that's going to be a better thing. One of the ways that you can try to do this is to help try to actually heal the gut. So again, there's a lot of links between the amount of inflammation that we experience in our body and the amount and basically our gut health. So making sure that the gut is healed and that you don't have other kinds of issues ends up being a problem. And then ends up being a little bit of an issue when it comes to the anti-inflammatory drugs, especially the non-steroidal anti-inflammatory drugs. Again, NSAIDs and different stuff like that, because that has the tendency to disrupt the gut lining, and it can have a problem with disrupting the microbiome in the gut. So there's multiple different issues with that. So again, if you can decrease the amount of those type of medications that you're taking, but still help to fix the problem, then that's going to be the way that you want to go. But besides that, again, you can have problems with people having issues with overgrowth of different types of bacteria or different kinds of stuff that happens in the colon and in the large intestine. So again, the general way to kind of look at it is that, you know, we have different kinds of stuff with the gut microbiome. We need to have, like, for example, like now it's springtime, we need to have a healthy lawn, right? If you have a healthy lawn, that's going to be the best defense against weeds. And that's the general idea of what happens when it comes to the issues associated with basically the gut microbiome. If you have a healthy microbiome, then you're going to end up having less likelihood of other kinds of organisms getting into the system and causing problems. So again, people that end up having like rounds of antibiotics, and again, sometimes people are going to need that, but if you have a round of antibiotics and you end up killing off all the good bacteria, then that's basically somebody having a lawn that's all messed up, and you end up, you know, having bare patches all over it. That leads for the ability for weeds to come back into the lawn and cause problems. So again, this is just one of the different effects. So by making sure that you're actually taking care of it and doing things like they show here, her eating yogurt, you can try to help to take care of that gut microbiome. So again, the way that it works is that the gut microbiome or gut bacteria are going to end up aiding with the immune system. Again, making sure that it works right, because, you know, the body isn't supposed to attack itself. So that's one thing that ends up being associated with it. The way that the body is supposed to work is that you're supposed to attack things that are foreign, not things that are you. And this is one thing that's associated with it. So breaking down other nutrients for absorption, helping to regulate chemicals that can communicate with the brain, things that can affect mood, memory, and sleep, and helping to regulate hormones within the body in order to keep everything balanced the way that it needs to be. Again, there's about 400 different types of species of bacteria that are going to make up the gut microbiome. There's a couple of them that are going to be a little bit more important than others. But again, when you end up having an imbalance of that gut microbiome, again, that's called dysbiosis. That can lead to a bunch of different problems. It can lead to a bunch of different issues with autoimmune diseases, other types of neurodegenerative types of diseases like Alzheimer's and Parkinson's and stuff like that. So it's one of those things where you have to make sure that you're taking care of your gut. And basically what it comes down to is that, you know, like I said, we need to make sure that we're taking care of our gut to make sure that we stay healthy, right? So you end up having gut dysbiosis. So, and again, when the bad bacteria are outweighing the good, or when you end up having maybe an overgrowth of yeast, as opposed to having the right amount of bacteria. Again, if you don't have the good bacteria, other kinds of stuff can get in there and cause problems. So dysbiosis can occur at any stage of life. It can happen, you know, for younger children. It can happen with adults. Again, that's not typically something that's going to happen when it comes to testing for it. Most medical practices aren't going to be going through and testing for gut dysbiosis. There's multiple different ways that you can do it, but you typically need to have somebody who's more doing functional medicine in order to help to test for gut dysbiosis. That's something that I typically don't test for in the office. I know a couple of different healthcare providers that are around here that do help take care of that. But again, that's typically done by testing fecal samples. Something that you would give a patient a kit and have them send that off to a lab, and then they would be able to get a readout from there and figure out what's going on. But to give you an idea of gut dysbiosis, there's a couple of different symptoms that you can have when somebody has gut dysbiosis. So for example, if someone has frequent gas, bloating, or belching, if you end up having problems with loose stools or diarrhea, or even constipation. Those could be different types of possibilities. Again, there's different ways that bowel movements should be, and there's healthy stuff and then there's not healthy stuff. There's even graphs and charts of how everything should look. So there's different things to kind of think of when it comes to that. So acid reflux is going to be another thing. People that have unexplained weight gain or problems with having difficulty losing weight, irritable bowel syndrome is basically a clue that the person ends up having a problem with gut dysbiosis. Anxiety, depression, problems with having a lower mood, it can all be related to it. Chronic bad breath, brain fog, joint pain in general, hey, arthritis, there you go. Skin conditions, again, acne, eczema, psoriasis can all be interrelated with this. Problems with energy or chronic fatigue. And again, the person just having a diagnosis of an autoimmune condition. Again, Hashimoto's thyroiditis, rheumatoid arthritis, some of that stuff can actually be controlled from a symptomatic perspective by what somebody eats and what you put into your body. Putting good stuff in is going to end up having a better effect than just eating stuff that comes out of boxes and cans and other kinds of stuff like that. So people can have issues with allergies and food sensitivities, or you can even end up having problems with chronic yeast or fungal infections or different kind of things like that. So there's a whole load of different things that can be related with gut dysbiosis. So basically the way that you treat it is trying to make sure that you rebalance the situation. Bad bacteria and yeast have the tendency to thrive on sugar. So different types of sugar are going to have an effect on it. So whether or not it's cane sugar, or if it's table sugar, or if it's high fructose corn syrup, or any of that kind of stuff, is going to all have an effect on it. And again, the artificial sweeteners can have an effect on it too. So again, those are going to be things that will have an effect. So the more that somebody is eating of things that are sweeter, the more problems that somebody would have with gut dysbiosis. And that's one of the things that you use in order to back off and decrease the amount of problems that somebody has. So again, the general idea is that you want to try to eat healthy. Again, and by that, you're talking at least 50% of your plate. You want that to be vegetables, right? So you want to have different versions of vegetables in your diet. And again, at least 50%, up to 70, 75% of the diet coming from vegetables. And again, that's volume wise. That's obviously not actually calories because you're going to get other kinds of stuff there. But if you talk about just the volume of food, most of that should be coming from your diet and vegetables. And again, making sure that you're, ways to increase this and ways to help this, again, besides getting rid of other kinds of stuff like chronic stress and stuff like that, would be adding vegetables into the diet. So eating lightly steamed vegetables, again, making sure that you have healthy fats, healthy foods. You can have fermented foods. So again, kimchi, sauerkraut, kefir, those are all different kind of things that can end up having an effect on it. And increasing the amount of good bacteria that's in the system. So the one part of it is that if you have bad bacteria and you don't have a lot of good bacteria, then you need to increase the amount of good bacteria. You increase the good bacteria by eating vegetables. That's one of the main ways to do it. You decrease the amount of bad bacteria by not giving it the foods that it thrives on. So if that's going to thrive on sugars, and if you don't give sugars, then you're going to decrease the amount of bad bacteria and you will increase the amount of good bacteria over time. And again, especially if you're adding on top of that other kinds of things like yogurt and sauerkraut, fermented types of foods and stuff like that. So there's a whole handful of different things. So that's one of the aspects of it. The other thing ends up being inflammation. And when it comes to inflammation, inflammation can happen in a couple of different ways that you can look at. So we end up having the first part of inflammation that people think of as the acute inflammation. And acute inflammation is going to be when something is red, it's hot, it's swollen. That's acute inflammation. But your body also has a chronic inflammation level to it as well. And the two of them end up, basically kind of working at the same time. There's a lot of information that we can go off on this, but I'm not going to do it right now. If you go and look on our blog or on our YouTube channel, you'll find some information about chronic inflammation and how you can actually start to help to control that, right? And some of that will actually give you some information on some of the foods and different ways that you can actually help to control it from the standpoint of controlling things from a food standpoint, and what are some other inflammatory foods versus anti-inflammatory foods. So I've got other information with that on my blog and in the YouTube videos. So again, inflammation is going to be one of the things that your body needs in order to help to fight off injuries and diseases. You know, again, if there's an injury and you end up having stuff that's going on that's associated with the injury, the body typically has to go in and it has to like eat away the injured cells or the dead cells or other kinds of stuff like that. The problem is that sometimes that inflammation can get too much. And if you end up having too much chronic inflammation, then you end up breaking things down too much. And then that can cause other issues, and that can cause extra pain. It can cause, you know, some swelling and other kinds of stuff like that. So there's multiple different issues with that. When it comes to inflammatory foods, and this is just to give you a couple of ideas of other things that are going to promote chronic inflammation, right? And again, chronic inflammation is going to be one of the major causes that we end up having that's associated with arthritis. And again, also associated with a bunch of other chronic type of diseases. Chronic inflammation is going to be something that's associated with that. So to help get rid of chronic inflammation, you want to try to get rid of some of the foods that are a little bit more inflammatory. So things that are inflammatory are going to be things like sugar. I think we already mentioned that, yeah. So when it comes to that, there's other kinds of stuff that are associated with it. Certain types of vegetable oils. So vegetable oils that are going to be associated with seeds have the tendency to be a little bit worse for you than things like avocado oil or coconut oil or different stuff like that. So things that are going to be vegetable oils that are going to be in like maybe mayo or some of the salad dressings that you might have, you know, again, not, you know, olive oil, but other kinds of stuff. So when you talk about like canola oil comes from the rapeseed is the name of the actual seed that it comes from. They changed the name for obviously PR type of reasons, but the general idea is that you end up having problems with multiple different types of seed-based oils, and those can all create issues with inflammation. Foods that are fried in oils are going to end up having problems with inflammation. Refined flours, you know, enriched flour, different types of stuff like that. Dairy can be a major issue. Artificial additives, other kinds of saturated fats. Again, not all saturated fats, but some saturated fats can be problematic. Things that are processed, like processed meats, again, bacon, hot dogs, bologna, different things like that. Again, not saying that these are things that you can never ever have, you know, because I know that I'm going to be eating some bacon. But the idea is that you want to make sure that you are limiting the amount of these inflammatory foods, especially if you have an inflammatory condition or if you're trying to prevent one of these other conditions. So trans fats is another thing. So things that are going to be in like margarine, shortening, certain kinds of baked goods like donuts and cookies and stuff like that can end up having issues with trans fats. Getting things through the drive-through is going to end up having a whole lot of processed foods associated with it. And again, alcohol, especially in excess, is going to be something that's going to have a problem. And again, if it's in moderation, it's okay. But again, too much of anything can end up being a bad thing. So there's a bunch of different things. And there's some other issues with when it comes to that. Again, I've got more information on this that you can look at, but to kind of quickly go over a couple of different things. But besides reducing the amount of foods that are inflammatory, that you can increase the amount of foods that are anti-inflammatory. So different things that can end up helping with that could be turmeric, ginger root, again, peppermint leaves, water. You can actually make that, and you can actually make a tea of some of those things. So if you, again, you take some grated ginger root, a teaspoon of turmeric, and you end up getting some peppermint leaves and getting some water with that. And all of that can sit there and steep, and that can give you a nice little tea. So that's one kind of thing that you can actually look at. When it comes to metabolism, again, there's other detoxification kind of programs that you can do. Again, there's multiple different types of things that, again, the idea behind this is not necessarily like, you can look at it as flushing toxins out of your body if you want to and stuff like that. But the idea is that helping to make sure that your liver actually is working as well as what it can. Getting rid of some of the food triggers, again, just kind of like stopping you from having them for a little while so that your body can adapt to not having them. And just by not having the food for a little while, you can stop craving that food. So there's multiple different issues that kind of goes along with that. So there ends up being issues with, again, making sure that you have enough antioxidants and stuff, making sure that you have enough hormones. So again, you can go through detoxification processes. And again, there's a lot of stuff from the standpoint of functional medicine that can help some of this. And again, like I said, usually this is going to be something that I refer out to other people to deal with, because it's, again, this isn't typically something that's things that I'm going to be dealing with. So again, the other kinds of stuff, and again, the foods that are going to be anti-inflammatory, so giving you an idea. And again, it depends on the person, because sometimes there might be something that might be listed on an anti-inflammatory food list that may be something that ends up being problematic for you. Where some people, eggs are a great protein and they're a great source of protein, but there's a lot of people that end up having problems with eggs. There's a lot of people that end up having, problems with things like soy and other kinds of stuff like that. So, again, those are things that you want to be careful of. So again, avocado can be great, coconut oil can be great, and coconut oil itself is a saturated fat. Again, grains are going to be something that you got to be careful with. So again, those refined grains you got to be careful with. So some of the gluten-free types of grains, again, buckwheat, millet, quinoa, rice, those are typically things that you can end up substituting. And again, there's multiple different things that are in that detox food plan. And I would recommend that you go over to my website, my blog, to take a look. And I'll make sure that that gets reposted or moved up so that everybody can see that. Again, elimination diets are another thing that can be beneficial. And again, if somebody is going to be going through and eating foods, sometimes you react to foods that you don't think that you're going to react to. There's plans that you can do in order to help to eliminate foods and help to reduce the amount of reactions that you might have. But truthfully, elimination diets can be a pain in order for people to do. So sometimes it actually ends up being a good idea to actually get a little bit of, especially if you have a lot of issues, if you have a lot of pain, if you have a lot of problems, sometimes it can be worth it for someone to actually pay for blood testing that can help to direct their elimination diet. So if somebody pays for blood testing and it shows 5 different foods that you might react to, like eggs, gluten, so like wheat, green peppers, and watermelon, or something along those lines, and you go through and you eliminate those foods for a period of time, you try to add them back in later on, but it gives you an idea of what to eliminate as opposed to going through that narrow little list. What happens if rice is in your elimination diet and you're allowed to eat it, but you actually do react to some of the proteins in rice? That would end up being kind of problematic, right? So again, elimination diets are one of the ways that you can end up helping to affect this from a more of a holistic kind of a standpoint. Supplementation is going to be another way that you can affect some of this stuff. So glucosamine and chondroitin can be 2 supplements that people can take in order to affect the issues that you might have with arthritis. So again, that's not typically something that's going to be popping up and you take it and you magically are going to be feeling better in a month. It usually takes, a good couple of months for people to be taking something like that in order for it to make a difference. And you can always take it preventatively too, again, especially if you have a profession where you are hard on your joints. So that's going to be something that I make sure that I take on a regular basis. Other things that you can end up having, supplements that you can end up working with. And again, this is another thing that I have a whole video about the top 5 or 6 supplements that people should be taking. If you go online, again, this is going to be talking about the top 5 supplements, and there's even an additional section of additional kinds of stuff for people to be taking. But again, omega-3 fatty acids are going to be one of the most important things that you can take in order to help to decrease inflammation. Vitamin D is going to be a big thing. Vitamin C can be a big thing. And again, there's other things when it comes to proteolytic enzymes and other kinds of issues like that. So when it comes to herbs, there's other kinds of herbs that you can take and you can eat on a regular basis, or you can take them as supplements as well. So some of the different kinds of stuff that's going to be associated with that, the big ones are going to be ginger and turmeric. So again, you end up having ginger root. Again, it's something that is excellent for you. It's very, very good at decreasing the amount of inflammation that you end up having in the system. So there's multiple different effects. Again, ginger, you can eat ginger itself. You can grind it up and put it in smoothies or in juicing. And then with turmeric, again, that's going to be the main kind of spice that you end up having in specific types of curries. So you can end up having, curries and you may be eating some Indian food, different stuff like that. Or you can also be taking some of those things as supplements as well. So there's multiple different things when it comes to that. So one of the things to look at is this whole kind of issue that we end up having with polypharmacy. So the thing to look at when it comes to this is that, again, there's about half of older adults, again, these are going to be the adults that are going to be mostly affected by having issues with arthritis. Again, they're going to be on multiple different drugs. And again, not to say that it's going to be everybody, but a lot of times people end up having this specific kind of decline that goes through. They end up having issues with falls. They end up having issues with causing problems with death. So there's multiple different stuff that's there. So again, polypharmacy is definitely an issue that people have, as opposed to chiropractic care, which again, I'm not going to say that chiropractic will fix everything. But the thing that's interesting is that when people get regular chiropractic care, the amount of hospital admissions is going to decrease by 60%. The amount of outpatient surgeries decreases by 62%. And the amount of pharmaceutical costs goes down by 85% when people are under regular chiropractic care. There's a couple of studies that were done out in Chicago several years ago where they basically had chiropractors acting as the primary care practitioner or primary care physician that was associated with a HMO, and everybody had to come into the chiropractor first. And by doing that, it reduced all of these different issues. So that's something that kind of think about when it comes down to it. When we talked about stuff before, when it came to the different issues associated with exercise, or when we talked about the issues associated with the muscle or the joints and the issues with the cartilage and how cartilage has to be stroked in order for it to be healthy. Again, this is going to lead to something that specifically exercise is going to be one of those things that helps to combat arthritis. Again, if it is a joint that is inflamed and it is red and it is swollen, then obviously you have to control what it is that you're doing. If exercise is aggravating it, then you have to push yourself to a degree, but you want to not obviously cause damage or injury. So there's a balance that has to take place with some of this stuff. But again, exercise is incredibly important for people to make sure that they end up feeling better and living a better life. So again, besides building muscle, besides lowering the blood sugar, and again, removing toxins from the blood, increasing the amount of good cholesterol that you have in the system, again, exercise is going to be one of those kind of things that is going to help to increase your range of motion, help you with strength, and again, help your endurance. And again, you can end up getting multiple different issues with that can end up helping you feel better. So one of the other issues that people can end up having is that, again, we had talked about the capsule that was in the system, and the capsule that was in the system, let's see here. So if I go back to here, okay, again, this was looking at the capsule. Notice that the capsule is up on the top and the capsule's on the bottom. We show the capsule that's out here on the outside, which is, this is the fibrous capsule that surrounds the joint, and this is the fibrous capsule that's over and through here. So that capsule that exists in that system you can end up having problems that are associated with that capsule, and that capsule can end up getting restricted, and it can end up getting fibrosis that's associated with it. So that's one of the things where this technique that I do called Graston technique is incredibly important. Basically, Graston technique is going to use these different types of tools to work on different areas of the body. There's different types of shapes, as you can see. And those areas of the body you can work in, you can actually get into the capsule, and you can end up breaking up scar tissue and adhesions and restrictions that are associated with the capsule in order for people to increase the range of motion and actually live a better life. So again, the thing that's cool about it is that when you rub it over an area, you can actually feel like a little grit that's associated with the scar tissue. And when you work over that area, you can actually loosen up the person during that treatment and significantly reduce the amount of pain and increase the amount of movement that the person has when doing that Graston technique. So again, by breaking up that connective tissue, again, it increases skin temperature. And again, you can end up having changes in the muscle patterns, especially for people that have had chronic patterns and changes in the way that the muscles actually work. So there's all kinds of different chronic conditions that this can help, and it can help people getting back to enjoying their everyday type of activities. So the other thing that's associated with this is going to be chiropractic care. So when it comes to chiropractic care, and again, this is showing an example of somebody getting their wrist adjusted, there's multiple different things that when it comes to chiropractic care, because chiropractic care is not only it's affecting the joint, but the muscles around it, but it's also affecting that same capsule that I was talking about as well. So you can get in there and you can work the capsule, and you can end up moving that capsule and breaking up some of the restrictions with some of the adjustments that you do. And again, the thing that's great about chiropractic care is that chiropractic care is actually extremely effective, and it doesn't cost a lot for the patient or even the system in general. Again, people that have chronic low back pain, which again, not everything is going to be arthritis, but people that have chronic low back pain end up getting the lowest cost and the shortest back pain episodes when they just had chiropractic manipulation. When you get medical costs, again, that's going to, or medical care, again, when the person comes in and you take muscle relaxers and anti-inflammatories, and then that doesn't work, so then they're going to send you to get a shot, or maybe they'll send you to PT first. They might. The idea is that if a person is coming in and getting adjusted, and again, you can do that at the same time, but that's going to be one of those things that is definitely going to be helpful to a person in order to help them get better. So again, when people end up having more visits to chiropractic physicians, there's fewer visits to their primary care doctors. And when that ends up happening, again, you end up getting lots and lots of savings. So again, you can have, more visits to the chiropractor can end up saving, $83 million a year, which ends up being obviously something to think about. So massage is another thing that can be helpful. There's other kinds of things like guided imagery, meditation, visualization. There's other kinds of issues that some people can end up getting a lot of benefit from acupuncture as well. So there's multiple different types of alternative type of treatments that people can use in order to decrease pain and inflammation. And those are some things to definitely think about. I definitely thank everybody for being involved. If you have any questions, I can take a look and we can kind of go over some of that. Let's see here. So if you wanted to put anything in the chat, that would be great. And like I said, I appreciate you listening. And if you have any questions, let me know. Thank you very much. And I will see you guys later. Bye-bye.